If you have swallowed a blood pressure tablet every morning for the last year, whether it was amlodipine, losartan, or lisinopril, how certain are you that you truly know what that medication is doing inside your body today? Not what appears on the prescription label. Not the brief explanation printed by the pharmacy. Do you genuinely understand how it works, the situations in which it can create problems, and the warning signs that distinguish a minor side effect from something that demands immediate medical attention? When that question is asked, many people hesitate. They are intelligent, responsible individuals who stay informed and manage their lives carefully. Yet the pause itself reveals something important. These medications are not simple supplements. They are not harmless vitamins. Amlodipine, losartan, and lisinopril are potent treatments that influence the heart, blood vessels, and kidneys every day. Even so, countless older adults take them routinely without fully knowing what symptoms deserve attention, what situations require caution, or when an ordinary feeling may actually be an important signal from the body. Consider Walter, a 74-year-old retired engineer. He was organized, disciplined, and meticulous. Every medication was taken exactly as directed. His daughter prepared a pill organizer marked from Monday through Sunday, and Walter followed it with the precision of a project timeline. When his physician added amlodipine to his treatment plan, he assumed it was simply another blood pressure medication. Same purpose, different name. That assumption nearly cost him a productive year. 3 months later, his feet had become so swollen that his usual shoes no longer fit. By late afternoon, his legs felt unusually heavy. Walking became uncomfortable, so he gradually reduced his activity. He even told his son that he feared his circulation was deteriorating. The possibility of heart failure frightened him. He searched for answers and worried that something serious was developing. The explanation turned out to be much simpler and far easier to manage. Walter had never been told that amlodipine, losartan, and lisinopril belonged to different medication classes. All three reduce blood pressure. Beyond that, they operate in very different ways. Amlodipine is a calcium channel blocker. It relaxes the smooth muscle within arterial walls, allowing blood to move with less resistance. Lisinopril is an ACE inhibitor. It prevents the action of an enzyme that normally causes blood vessels to tighten. By interrupting that process, blood pressure falls. Losartan belongs to the ARB family, known as angiotensin receptor blockers. It affects the same general system, but works through a different pathway, a distinction that becomes more important than many people realize. 3 medications, 3 mechanisms, 3 separate side effect patterns, 3 different warning signs to recognize. Once you understand those differences, you stop interpreting every symptom through the same lens. Walter's swelling was not heart failure. It was a known effect of amlodipine. A significant number of people taking amlodipine experience swelling because the medication relaxes arteries more effectively than veins. As a result, fluid can accumulate in the lower legs. After the cause was identified and addressed, Walter returned to his regular walking routine within a matter of weeks. The name written on the prescription bottle is more than a label. It identifies a category, and that category often reveals what patterns to expect. One of the most misunderstood reactions associated with blood pressure treatment is the swelling linked to amlodipine. Many people taking the medication experience it. The process is relatively straightforward. When amlodipine relaxes the small arteries in the legs, blood enters those vessels more easily. The veins responsible for returning blood toward the heart do not relax to the same extent. That creates an imbalance. More blood flows in than flows out. Pressure rises in the tiny vessels around the ankles and feet. Over time, that pressure forces fluid from the bloodstream into surrounding tissues. The result is familiar to many patients. Ankles become puffy. Socks leave deep impressions. Shoes feel tighter than before. By late afternoon, the legs may feel heavy and full. This is not typically the result of eating excessive salt. It is not usually a sign that the kidneys are failing. In most situations, it is not the beginning of heart failure. Instead, it is a predictable response related to the way amlodipine functions. The more serious issue is often not the swelling itself. It is how people react to it. Some individuals notice the swelling and stop taking the medication without informing their healthcare provider. Blood pressure then rises again, often without obvious symptoms. Others continue taking the medication, but reduce their water intake because they assume they are retaining fluid. That response moves in the wrong direction. Dehydration while using a calcium channel blocker can create additional concerns. Some people, like Walter, simply tolerate the problem for months. They become less active, worry about severe illness, and experience an unnecessary decline in quality of life. The most important step is communication. Swelling in the legs while taking amlodipine should be discussed with a physician. That does not automatically mean the medication is inappropriate. It may mean adjustments are needed. There could be alternative treatments. There may be strategies that make the side effect easier to manage. Raising the legs periodically, changing the timing of doses, or reevaluating the overall medication plan are all possibilities. None of those options can be explored if the symptom is never reported. Another important discussion involves lisinopril and the side effect, for which ACE inhibitors are perhaps best known. The cough, not a wet cough, not one that produces mucus. Instead, it is typically a dry, persistent irritation that feels like a constant tickle in the back of the throat. It often becomes more noticeable at night. Cough drops rarely solve it. Lozenges usually do not help. Antihistamines frequently make little difference. What makes this symptom particularly confusing is the timing. It does not always appear right away. Some people notice it during the first week. Others develop it after 3 or 4 months. By then, the connection to lisinopril may never enter their minds. They have been taking the medication for months without any obvious problems. As a result, they blame other causes: dust, seasonal allergies, lingering irritation after a cold, acid reflux. Evelyn's experience illustrates this perfectly. She was 71 years old and loved spending time gardening. When the cough began during late spring, she assumed pollen was responsible. The timing seemed to make complete sense. She tried antihistamines. She purchased an air purifier. She mentioned the issue to her primary physician, who ordered a chest X-ray. The imaging study showed nothing concerning. Yet 6 months later, the cough remained. Night after night, it interfered with her sleep. She became increasingly tired. Her patience wore thin. Eventually, she began to wonder whether a serious condition had somehow been overlooked. When Evelyn came in for evaluation, one of the earliest questions asked was simple. When did the cough begin compared with the start of lisinopril? She paused. Then she reached for her phone and worked backward through the timeline. Lisinopril had been started 11 months before that appointment. The cough appeared roughly 4 months after treatment began. The connection had never occurred to her. After the probable cause was recognized, she worked with her primary physician and changed to losartan. The medication acts on a related pathway but is not known for producing the same type of cough. Within 2 weeks, the irritating sensation in her throat disappeared. 11 months of interrupted sleep ended in only 2 weeks once the source of the problem was identified. There is another issue associated with the ACE inhibitor category that must be separated clearly from a simple annoyance. One is inconvenient. The other is a medical emergency. If you are taking lisinopril and notice swelling involving the lips, tongue, face, or throat, especially if swallowing or breathing becomes difficult, immediate action is required. Do not wait. Do not postpone it until the next day. Do not take Benadryl and watch what happens. Emergency medical services should be contacted at once. This condition is known as angioedema. It does not happen often, but it is genuine, and it can block the airway much faster than many people realize. A dry cough may be bothersome. Swelling in the throat is an emergency. The difference between those two situations matters enormously. Now consider losartan and a risk that stands out because it often develops when people believe they are making healthy choices. Losartan, like lisinopril, influences the renin-angiotensin system, one of the body's key blood pressure control mechanisms. A consequence of this medication group is the potential to increase potassium levels in the bloodstream. For most individuals, regular monitoring keeps those levels within a safe range. However, when certain common habits are added to the equation, circumstances can change. The surprising part is where potassium may come from. It is not limited to bananas or dietary supplements. Many products promoted as healthier alternatives contain substantial amounts. Salt substitutes are a good example. Numerous low-sodium alternatives displayed beside traditional table salt and often marketed as heart-healthy products replace sodium with potassium chloride. A senior who has been instructed to reduce salt intake may purchase one of these substitutes and begin using it generously with every meal. At the same time, they may already be taking a medication that tends to increase potassium. That combination can elevate potassium enough to interfere with the electrical activity of the heart. The danger is that high potassium does not always create dramatic warning signs. Sometimes it appears quietly. Muscles may feel weaker than usual. Fatigue may linger. Leg cramps can develop. Tingling sensations may occur in the hands. An irregular fluttering heartbeat may appear. In some situations, very few symptoms occur until the condition becomes serious. Think about someone close to you, or perhaps yourself, who switched to a salt substitute within the past 1 or 2 years. If that individual also takes losartan or lisinopril, it is worth discussing with a physician. Not because the medication alone is unsafe, not because foods containing potassium are harmful. The concern is that combining these factors without awareness or monitoring can create a gradual problem that might have been avoided entirely. Electrolyte powders deserve consideration as well. Certain meal replacement shakes do too. Some over-the-counter sports recovery beverages contain meaningful amounts of potassium. These are not prescription medications. People rarely think to mention them. That is precisely why they matter. Another situation deserves much more attention in discussions about blood pressure treatment, especially among older adults. What happens when illness arrives? Not a hospitalization, not a major medical crisis, something much more common: a stomach virus, several days of vomiting, persistent diarrhea, a reduced appetite lasting a few days, or simply a hot summer week with heavy perspiration and inadequate fluid replacement. When dehydration develops for any reason, the same dose of losartan or lisinopril that worked perfectly in a well-hydrated body may behave very differently. Blood pressure can drop excessively. The kidneys, already under stress because of fluid loss, become more vulnerable. Dizziness may appear. Weakness can develop. Lightheadedness may follow. Acute strain on the kidneys can emerge more quickly than most people expect. The medication itself did not change. The body's internal conditions changed. Now the drug is functioning in an environment different from the one for which the dosage was originally adjusted. This is one of the most practical lessons to remember. Illness changes the rules. Without a plan for those situations, uncertainty creates risk. Should a dose be held? When should a physician be contacted? Which symptoms require an office visit? Those answers should already be established before illness occurs. That plan should come from the prescribing physician long before it is needed. If no such plan exists, it is worth requesting one during the next appointment. A valuable question is simple. What should I do with my blood pressure medication if I develop a stomach virus or cannot keep food and fluids down? It is among the most important questions a patient can ask. Yet it remains one of the least common. Now imagine another situation. It has been a difficult week. Arthritis symptoms flare. The knees hurt. The back becomes stiff. A trip to the drugstore follows and ibuprofen is purchased. It is familiar. It has been used for years. It sits on a store shelf and can be purchased by anyone. Meanwhile, losartan or lisinopril is already part of the daily routine. Perhaps a diuretic is being taken as well for additional fluid management. When used regularly, this combination can significantly reduce blood flow to the kidneys. If even mild dehydration is present, the possibility of kidney injury increases considerably. This is not an unusual scenario. It is one of the most frequent preventable situations encountered. The reason it is often missed is straightforward. Many people do not think of ibuprofen, naproxen, or similar over-the-counter anti-inflammatory drugs as medications in the same category as prescriptions. They view them simply as pain relievers purchased from a store. The kidneys do not make that distinction. They respond only to chemistry. If anti-inflammatory medications are used regularly for arthritis, joint discomfort, or back pain, while also taking any of these 3 blood pressure medications, that discussion should take place with a physician. In many cases, safer alternatives exist. Acetaminophen may be appropriate. Topical therapies may help. Physical therapy approaches may offer relief. Other options may be available that do not carry the same level of kidney risk. Pain does not always have to be endured. Risk does not have to be accepted in silence. Often there is a better solution. The key is finding the right guidance. There is also a symptom that sounds minor but should not be dismissed. Dizziness. That brief, unsteady feeling when rising from a couch. That moment after getting out of bed in the morning. For an instant, the room seems to tilt. You stand up from the couch. For a brief moment, everything feels unsteady. You reach for a nearby door frame. A few seconds later, the sensation fades and the day continues. Many older adults taking blood pressure medication experience this regularly. Most never mention it because it seems insignificant. But there is something important to understand. For seniors, only a few seconds of dizziness can be enough to trigger a fall. A fall can lead to a fracture. A fracture, especially involving the hip, can alter an older person's health and independence for years. In some cases, recovery is never complete. This is not exaggeration. It is simply the reality of biology and physics working together. The dizziness occurs because the medication is performing its intended function by lowering blood pressure. When a person stands up quickly, the cardiovascular system may not have enough time to adjust. Blood pressure briefly falls. Blood flow reaching the brain decreases for a short period. The result is that lightheaded, tilting feeling. Often, the solution is straightforward. Stand up gradually. Before rising from bed, sit at the edge for a moment. Use a stable object for support when getting up. Allow a few extra seconds for the body to adapt to the position change. However, practical adjustments are only part of the picture. If dizziness happens frequently, if it continues beyond the first few weeks of treatment, or if there is an episode that nearly causes fainting, those situations deserve proper discussion. The dosage may require modification. The medication combination may need reevaluation. Hydration habits may need attention. Remaining silent about these symptoms carries real risk. Another issue causes unnecessary worry and sometimes leads to poor decisions among people checking blood pressure at home. Blood pressure is not a fixed value. It changes continuously throughout the day. Many factors influence it. Sleep quality matters. Caffeine can affect it. Pain can affect it. Anxiety can affect it. Even concern about the reading itself can affect it. Walking in from outdoors shortly before measurement can influence the result. Speaking loudly before sitting down can influence it as well. One elevated reading on a random Tuesday morning after poor sleep does not automatically mean the medication has failed. One unusually low reading after dehydration on a hot day does not automatically mean the medication is too strong. The key is the trend over time. Measurements should be taken consistently. Use the same arm. Measure at the same time of day. Rest quietly for 5 minutes beforehand. Avoid rushing. Avoid talking during the process. When monitoring is inconsistent and reactions are based on isolated numbers, poor decisions often follow. Extra doses may be taken out of fear. Scheduled doses may be skipped because one reading looked favorable. Calls may be made in panic about a number that was actually unremarkable when viewed in context. Follow a method. Record readings over time. Bring those records to appointments. Let long-term patterns guide decisions rather than anxiety. This simple approach lowers stress, improves judgment, and provides far more useful information than a single concerning image from a home monitor. These medications depend on steady presence within the body. They do not work best through sudden increases and decreases. They are not intended for extra doses during moments of worry. They are not meant to be skipped simply because you feel well. Amlodipine, losartan, and lisinopril are not rescue medications. They are not used the way someone might take a pain reliever after a headache begins. Their purpose is to maintain a stable chemical environment within the cardiovascular system over time. When consistency is interrupted through missed doses, double doses, or unpredictable timing, blood pressure may rise or fall in ways that create the impression that the medication is ineffective. In reality, the problem may be the usage pattern itself. If a dose is forgotten, general recommendations for many blood pressure medications suggest taking it once remembered unless the next scheduled dose is approaching. In that situation, the missed dose is usually skipped and the normal schedule resumes. 2 doses should not be taken together to compensate for one that was missed. Still, rather than relying entirely on general advice, obtain instructions specific to your own medication from the prescribing clinician. Write those instructions down, store them in your phone, keep them with your pill organizer. When the moment arrives and you realize a dose was missed, uncertainty is the last thing you need. Perhaps the most important message is this. The best blood pressure medication is not necessarily the one that creates the most impressive number on a chart. The best medication is the one that can be taken safely, regularly, and comfortably within the reality of your overall health, daily habits, other prescriptions, and everyday routine. A drug may look excellent on paper, but if it keeps you awake every night, causes swelling severe enough to stop you from walking, or leaves you so dizzy that standing becomes frightening, then it is not truly successful for you. Side effects are not a personal weakness. They do not mean you are overly sensitive. They are information. They are the body's method of communicating through symptoms. Those messages deserve attention. They deserve evaluation. And they deserve a thoughtful response. Many older adults tolerate side effects without saying anything because they assume the medication is necessary, and therefore the discomfort must simply be accepted. That belief is not medically sound. In most cases, options exist. The dose may be adjusted, timing may be changed, a different medication class may be considered. Combination approaches may be explored, but those possibilities only become visible when concerns are voiced. Silence is not the same as cooperation. Quietly suffering through a side effect that makes you dread taking medication each morning is not commitment. It can become the first step toward stopping treatment entirely without informing anyone. Then blood pressure rises again, and the problem catches everyone by surprise. Your input is part of the treatment process. Use it. Keep this simple framework in mind. If you take amlodipine, pay attention to swelling in the ankles and legs, especially later in the afternoon, and report it instead of enduring it. If you take lisinopril, watch for a persistent dry cough that does not improve with other measures. And remember that swelling involving the throat or tongue is a true emergency requiring immediate medical care. If you take losartan, stay alert for possible signs of elevated potassium, including muscle weakness or an irregular heartbeat. Review the ingredients in any salt substitute you use. Have a sick day plan prepared before illness occurs. For all 3 medications, stand up slowly to reduce fall risk. Check blood pressure using a consistent routine. Avoid combining them casually with anti-inflammatory pain relievers without medical guidance, and never stop treatment suddenly without first speaking with your physician. Understanding medication is not about fear. It is about clarity. Clarity transforms a prescription bottle into a treatment plan that makes sense and can be followed with confidence. If this information was helpful, share it with someone who is managing blood pressure and may benefit from understanding these medications more clearly. The right information, understood at the right time, can help prevent real harm and improve daily life. Please leave your thoughts about this content in the comments below. Thanks for watching. See you in the next one.